Essential tremor is a condition that causes a tremor, usually in the arms, but sometimes a tremor of the voice and sometimes a tremor of the head. This tends to come on at any time during life, but it is more common as one gets older. Quite often it does run in families. Essential tremor is often able to be treated by simply avoiding things that tend to stir the tremor up. Often this might be a cup of coffee, for example. In very mild cases of essential tremor, no treatment may be required. If the tremor becomes a problem for the person, then we usually try medications such as beta blockers. In most patients, a good benefit's obtained with these beta blockers and they can go about their life in a fairly normal way. A small proportion of patients either don't respond very well to the beta blockers or their tremor deteriorates as they get older, and these are the patients that we might consider for deep brain stimulation. Treating patients who have essential tremor with deep brain stimulation can be very satisfying. These patients often obtain a fairly dramatic effect in terms of reducing their tremor, and in some cases the tremor can almost disappear completely. Traditionally, deep brain stimulation for essential tremor has involved targeting the thalamus, or specifically the ventralis intermedius nucleus, or VIM. This has been a target that's been used for well over 10 or 15 years with generally good results. More recently, several groups, including ours, have been exploring the option of other targets, often in association with VIM. This other specific target is known as the posterior subthalamic area. By selecting two targets in a particular patient, usually with the one electrode, we can offer the patient a greater chance of benefit than they might have obtained with just a single target. We would expect that at least 80 or 90% of patients with essential tremor would obtain a very good benefit with deep brain stimulation, and that benefit would be maintained in the long term. The evaluation of a patient with essential tremor is very important. We need to make sure that they actually do have essential tremor and not some other condition that might be causing a tremor, such as Parkinson's disease. Generally, the type of tremor that you see with essential tremor is different to Parkinson's disease, and we would make sure that they've had a good neurological assessment and a firm diagnosis before we head down the path of deep brain stimulation. We'd also need to be sure that they've tried all medications and that they've failed to obtain a benefit with such medications. We don't want to offer surgery to patients who can easily be treated with a tablet. Once we're certain of the diagnosis and comfortable that the patient has tried all non-surgical means, the next step is to get them assessed by a psychologist and neuropsychologist. We need to be aware of any other problems such as depression or significant anxiety, which may have an impact on either their surgery or their post-operative recovery. We need to make sure that there are no structural problems with the brain that would prevent surgery, and also that there are no bleeding conditions or other medical problems that may make the surgery too dangerous. With DBS for essential tremor, we often see an instant result. On the operating table, when we turn the current on, if we're in the right position, the tremor stops usually straight away. Patients with essential tremor are usually very satisfied with the outcome of deep brain stimulation. They tend to obtain a very early and often dramatic benefit from stimulation, and in most cases they leave the hospital in much better condition than they came in.
DBS has undergone quite a transformation over the past 10 years. We've gone from a procedure, a technique which was initially licensed and utilised to treat movement disorders such as Parkinson's disease, and we went from the point where it was considered relatively experimental in the treatment of Parkinson's disease to the point now where we have very good level 1 evidence supporting its efficacy, and it's a very well established strategy for those patients. But there are a number of other conditions that we're now looking at using deep brain stimulation to treat, and I was going to talk about a few of these conditions and about our experience with these. The first field is that of psychosurgery, and depression is really a major problem for the community and